an issue that's really been very controversial over the years is whether hormonal contraception, whether it be, the oral birth control pill or, an IUD that elutes hormones such as the Mirena or the Nuva ring, that's, the vaginal ring, etc. Anything hormonal, or the Depo, Provera, for example, anything hormonal, whether use of those can increase the risk for breast cancer. And there have been some really good studies looking at this. And I think the most recent study that I remember is from Scandinavia, one of the Scandinavian countries. They have these national registries of everyone's health issues and every prescription that a person has ever been on over their lifetime. It's a national health system. And they published a very nice paper that basically showed that in general, the longer a woman is taking hormonally based contraception, that her risk of breast cancer does go up by a little bit. It's not a big increase, but they also showed that when a woman stopped the use of hormonal contraception, that about 5 years later, her risk of getting breast cancer was right down to the average population, as though she had never really used hormonal contraception. So I think, however, that there's some caveats in this, and that is that the very long-term use of hormonal contraception is not uncommon in our country. Girls may start it for, using it to help with menstrual pain, for example, or acne, for example, at a young age, sometimes in the early teen years, and will use it, until they have their first child and then get back on it. So women may be on hormonal contraception for truly decades. We don't have really good data long-term about what the risk is of increasing breast cancer risk with very, very long use. And then we don't also know, for those who have been on it for decades, when they stop it, does their risk go down to the population risk? I suspect not, from what I've seen in my own practice. And one thing I have noticed is that a long time use of hormonal contraception that can even roll into hormone replacement therapy after a woman's menopausal, so you can not skip a beat and go right into hormones after the menopause, is that coupled with considerable alcohol drinking is a way I find to cause breast cancer in women who don't otherwise have reasons to have breast cancer. No family history, they may have had their children at a young age, etc. I've noticed that long time use of hormones with, considerable, that usually means more than one drink a day on a regular basis, will increase breast cancer risk just in and of itself. So that's a combination, I think, to watch out for. My own feeling is that we ought to utilize hormonal contraception as less as we need to in life. When we have the opportunity to use a different form of birth control, I think we should consider that. And also with hormone replacement therapy, I think some years after menopause to help with hot flashes and night sweats and the usual menopausal things. But, after 4 or 5 years, just consider getting off of it. So I think minimizing it is important. There are certain formulations of hormonal contraception that increase risk more than others. For example, the birth control methods where you don't have a menstrual period, the pills where you just take the hormones continuously without a menstrual period, those are known to increase the risk of breast cancer more than those where you do have a period. And also the hormonal contraception that's based more on the progesterone hormones than the estrogen hormones also increase the risk, such as the Mirena IUD, for example, the Depo, Provera. In this big Scandinavian study, those particular formulations increased the risk a bit more than those that were more balanced between estrogen and progesterone. So the bottom line is, I think we've got to do what we've got to do. Pregnancies, when they're not at the right time in life, are something to be avoided, but utilizing hormonal contraception for the shortest period possible, I think, is a very good strategy.